Hi everyone. Hello. Everyone jump on in. We're gonna get into some things today. You are first. I'm just waiting on my coworker, Ibukun, to hop on with me. Okay, view request. Go. Um, there we go. I'm not sure. Well, while we wait on Ibuku, everyone, let me know in the comments how your day is going. It's pretty chilly to me, so I'm enjoying hoodie weather. Okay, let's try this again. Hi. There
Hello.
we go.
Sorry.
Hello.
How are you?
How are you?
I'm
I'm
do
good. How are you?
I'm doing great. Am I lagging a little or is it good?
Just a little bit, but it's good.
Okay.
Okay.
Let me know when you're all set.
Definitely pin the comment,
Yes. Could you pin
and
it?
then,
Because you
um,
started the live, so you have to do it.
okay, let me go copy it. There we go.
Did it work? Okay. Cool.
Post, and then pin comment. Okie dokie. Well, first, I'm going to introduce myself. My name is Marshun. I'm the community outreach specialist here at Whitman-Walker Health, and my pronouns are he and she. And I'm joined today with one of my newest colleagues, Ibuku, and I'll allow her to introduce herself.
Okay, hi everyone. My name is Ibukun, and I am the new AmeriCorps Fellow at Whitman-Walker. And my role is Social Media Prevention Outreach Coordinator, and I also do HIV testing. And I use she, her pronouns, and I'm really excited to be in this space with you all and looking forward to talking about PEP with everyone today.
Yes. So, everyone, during the past few months, Whitman Walker Health's Community Health Department team has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI sexual health practices, access to care, social determinants of health, and general public health interventions. The next series of outreach sessions will focus on the current pandemic COVID-19 and ways to manage your sexual, personal, and mental health. The community health team is here to help. It's here to help you as well as educate you as well.
So today we're going to talk about PEP, which is post-exposure prophylaxis. And, not a lot of people know about PEP, but it's a pretty simple medication and very effective medication against that prevents against acquiring HIV. And it's also really easy to get a prescription for, and it could help anyone that's listening.
Yes, I think I know a little bit about PrEP, but not a lot about PEP. Can you tell me the difference between PrEP and PEP?
Yeah, of course. So PrEP stands for pre-exposure prophylaxis. So let me just break down these words. Pre-exposure means you use it before you have an exposure to HIV. And prophylaxis is basically just a fancy word for a preventative measure. So PrEP is a medication that you take before you get exposed to HIV. So you
Okay.
take PrEP, you take the pill, once a day for however long you're sexually active. And basically, whenever you come in contact with HIV through a sexual contact or, through a needle use, your risk of getting HIV is reduced by 99%. So it's a really amazing and effective medication that prevents individuals from, contracting HIV. And with just this little pill, even if you have unprotected sex with someone who has HIV, you are significantly reducing your risk of acquiring it.
Okay, yes, thank you for sharing that, Ibuku. So when I think of PrEP, I think of maybe like birth control. Is that right?
Yeah, no, I think that's a really, really good way to think about PrEP. So PrEP is basically the birth control against acquiring HIV because, similar to birth control, you have to take it every day. And the more consistent you are, it increases the effectiveness of the medication. So yeah, I think that's a really, really great way to think about PrEP as like the birth control against contracting HIV. So yeah.
Okay, so if PrEP is like the birth control for HIV, what is PEP and why is it so important?
Yeah, so I'm going to talk a little bit more about PEP. So, like I said, PrEP is the pre exposure prophylaxis, PEP is post exposure prophylaxis. So, I'm going to break
Okay.
it again. Post exposure means you take it after a known exposure to HIV. And like I said before, prophylaxis is just a fancy way of saying a preventative measure. And the difference between PEP and PrEP is the timing. So like I said, you take PrEP before you are exposed to HIV, you take PEP after the exposure. So let me just give you a couple scenarios of why PEP is an important medication. So
Okay.
let's say, you go to the bar or somewhere and you meet someone and you have unprotected sex with them. And after this encounter, you start to get worried because you didn't get a chance to have a conversation about their sexual status, or, it was just like all happened really fast. So now you're worried that you might have been in contact with HIV. Um, so that is a great scenario where PEP is the medication you want to look to. Another scenario I'm going to share is, let's say you're just sharing like needles, syringes, or other equipments to inject drugs. Or trigger warning, you experience a sexual assault and you're just not sure if you might have been exposed to HIV from these encounters. This is a perfect scenario where you should look to taking PEP. Um, yeah, I hope that helped explain different scenarios and why PEP is important.
Okay, so PEP is kind of sort of like the morning after pill in terms of HIV. You said that you have a window period. So how long after, your encounter do you have to start PEP? I don't know if
Yeah.
I'm jumping ahead.
Oh yeah, yeah. So like you said, PEP, you should think of it like the morning after pill. So the morning after a known exposure, or I mean, it doesn't have to be literally the morning after, but just that's the way we should just kind of think about it. But in order for PEP to work, you have to start taking it as soon as possible. So in
Okay.
fact, your healthcare providers will only prescribe PEP to you if your exposure was fewer than 72 hours ago. So let me repeat this. The PEP, you're only eligible to get on PEP within the 72 hours after your exposure period to HIV. So that timing is really important because after 72 hours, the medication becomes so much less effective that medical providers won't even consider giving it to you. So you have to make sure that you are aware about PEP and its importance, and you get in contact with your medical provider as soon as you can. And you have to take PEP for 28 days consecutively to ensure you are getting the full results.
Okay, so Ibuku, how effective would you say PEP is?
So PEP is extremely effective. Studies have shown that PEP reduces your chance of acquiring HIV by more than 80% when taken correctly, meaning you take it within the 72-hour window and you also take it once a day for 28 days. So it has a really high effectiveness rate.
Okay. Thank you for sharing this. So, is PEP easy to access? Like, can I get PEP where I get prep from? What's the variance for availability?
Yeah, definitely. PEP is fairly easy to access. You can get it from your nearest emergency room, You can contact your primary care provider, or you can even come to Whitman-Walker here. You can come to us. We have an expansive clinic that's ready and willing to provide PEP for you as long as you fit the, the time window and you're willing to take it for 28 days. So getting PEP at Whitman-Walker is really easy. You just call the number 202-797-4439, and the number is pinned in the chat, so you have access to that. And if you call us during our normal business hours, we do have operators that pick up the phone and will direct you to a line of care. You'll also talk to someone who can collect your information from you and help you fill out a patient registration form. And then they'll put you in contact with the nurse and a medical provider who will answer any questions about PEP and will write a prescription for you over the phone. And then all you have to do is go pick up your prescription from the pharmacy and start taking your pills for 28 days.
Okay, that sounds pretty easy. So if I'm ever interested in PEP, I can just call the number we have pinned below.
Yes, correct.
Okie dokie.
Yes.
Well, apart from PEP, Ibuku, are there any other ways to prevent contracting HIV? I know you mentioned PrEP and PEP, but are those like my only two options?
No, those are not your only two options at all. There are a number of ways that are easier, cheaper, less stressful, because I know it can be stressful thinking about, taking a medication every day. But there's many ways that you can really take control of your sexual health. For starters, we highly recommend that you use condoms correctly and as often as you can. You could also have you and your partners get tested for HIV and STIs frequently. You could also engage in long-term monogamous relationships, or you can just choose to not have sex at all. You have many options. You can also, like we said, get PrEP at Whitman-Walker. And PEP is just an extra way to ensure that you remain HIV negative.
Okay. And where can I make appointments to get testing for my partner and I?
Yeah. So like I said, Whitman-Walker, we have HIV STI testing available. So we have the Liz location, which is in Northwest DC, 1377 R Street. And then we have our MRC location in Southeast DC. And you can also make your appointment by calling the number 202-797-4439. And like we said, the number is pinned. So go ahead and give us a call if you ever want to make an HIV STI appointment for you or your partner.
Okay. Thanks for sharing that, Ibuku. Is there anything else you think we should know?
Yeah, so just before we go, I just want to give a few reminders about COVID-19, the pandemic that we're living in right now, and the vaccines. So if you've already gotten vaccinated, congratulations. You've taken a really important step to preventing yourself, your loved ones, and your communities from illnesses. The Delta variant is soaring across the US at this moment, and it is totally understandable why you may want to continue wearing your mask. The vaccine is 100% effective, and more contagious variants are spreading. And there are very few protocols in place to actually verify that folks around you are vaccinated. So please continue staying alert. And if you haven't been vaccinated and you're looking for an appointment, Whitman-Walker has a COVID-19 vaccine available. Everyone ages 12 and up are eligible to receive the Pfizer COVID-19 vaccine, and everyone ages 16 and up are eligible to receive a COVID-19 vaccine. So you can call us to make an appointment at 202-207-2480 to make an appointment. And for our DC residents watching live, you can receive more information on COVID-19 vaccine walk-up locations at vaccinate.dc.gov, or you can call the number 1-855-363-0333. For Maryland residents, you can on the website covidlink.maryland.gov or call the number 855-634-6829. If you live in Prince George's County, visit their vaccination registration portal there. And if you're in Montgomery County, you could call the number 240-777-0311. And for Virginia residents watching live, you can learn more about Virginia vaccine distribution at the website vaccinate.virginia.gov, or you can call the number 877-829-4682. If you haven't been vaccinated and you're not appointments, we urge you to continue to follow the CDC guidelines for mask wearing, quarantining, social distancing, and everything else. It's very important for you to get the vaccine, and you can discuss the COVID precautionary measures with those around you, and be mindful of masks and keep your distance, especially when you don't know if the person around you is vaccinated or not. And finally, if you'd like to support Whitman-Walker and our mission, register to walk, run, or donate to this year's virtual walk and 5K to end HIV, which is occurring on Saturday, October 23rd. And this is a really special year because it's the 35th anniversary of the walk. So you can register yourself at walktoendhiv.org. And finally, remember to follow us on Instagram, Facebook, Twitter at Whitman-Walker. And you can also check out our website at www.whitman-walker.org for the most up-to-date information on our services and for more COVID-19 resources and general Whitman-Walker services. And like we said before, you can also call us at 202-797-4439. Follow some of our programs and Whitman-Walker Health Family at Real Talk DC _ at No Filter DC, and at The Corner DC. Thank you so much for coming today, everyone. Thank you so much, Marshun, for being part of this live with me. I appreciate it.
Thank you, Ibukun. You did great. And anyone listening, if you're interested in PEP, PrEP, or HIV and STI testing, feel free to call the pin number below, or DM us on Instagram. And I hope everyone has a great day.
Yes. Have a great day, everyone.
Bye.
Bye.